Since the beginning of humanity, people have had a wide range of illnesses, whether they were wealthy or not. Let's go and find out the most contagious diseases in the world. A typical cold. Nasopharyngitis, sometimes known as the common cold, affects people of all ages every year and is brought on by more than 200 different viruses. Adults experience colds 2 to 4 times annually, whereas children under 2 might experience up to 10 colds annually. The majority of colds are brought on by touching your face after handling a contaminated thing. The 2 most typical signs are weariness and a stuffy or runny nose. The common cold normally has no lasting repercussions, but it can occasionally result in more severe issues. Some people, especially elderly persons, may develop meningitis or pneumonia. Flu. The flu virus is extremely contagious and can survive up to 48 hours on surfaces. This means that even just handling contaminated objects can make you sick with the flu. The same holds true if you breathe in contaminated droplets that have been released into the air by an affected person. Flu symptoms include fever, a cough that comes on suddenly, a sore throat, extreme exhaustion, headaches, and discomfort in the muscles and joints. However, the flu can spread even before symptoms develop. In fact, some patients can spread the illness up to 24 hours before any symptoms show. Influenza can have catastrophic repercussions, including hospitalization and even death, for some at-risk people. Chickenpox. The chickenpox is a very contagious illness. Prior to the invention of vaccines, 90% of 12-year-olds and 50% of 5-year-olds had the disease. This condition, which appears as tiny, fluid-filled pimples, is caused by a virus that is primarily disseminated through the air. The virus can linger in the air for several hours even after an infected individual has left the area. The chickenpox can occasionally result in fetal abnormalities in pregnant women. Cytomegalovirus. In spite of the fact that cytomegalovirus (CMV) is generally harmless in children and adults, pregnant women are at greater risk. Deafness, blindness, and intellectual disabilities can affect children whose moms are infected. According to estimates, CMV infection has already occurred in between 50% and 80% of persons under the age of 40. It's crucial that pregnant women avoid dish sharing, especially with their children, and constantly wash their hands because urine and saliva are the main vectors of transmission. HIV. Human immunodeficiency virus (HIV) infection affects over 38 million people worldwide as of 2019. HIV can be spread through blood transfusions or sexual contact. One of the causes is the use of non-sterile equipment. Contrary to widespread perception, taking a bath or using a public lavatory cannot make you contract HIV. HIV-positive individuals can experience significant weight loss, nausea, and diarrhea in addition to a fever, headache, and pain in their muscles and joints. But some people will continue to have no symptoms. Throat infection. Children 20%-30%, and adults 5%-15% both have sore throats due to strep throat on a regular basis. When an infected person coughs or sneezes, the bacterium that causes this illness spreads through the air. Since the development of antibiotics, the likelihood of experiencing strep throat complications has significantly decreased. Hepatitis B virus. Sexual contact is one of the most typical methods for hepatitis B to spread. However, if you come into contact with an infected person's saliva, breast milk, urine, tears, or blood, you could potentially contract the illness. While the majority of patients are able to completely rid their bodies of the virus after a few months, 5% to 10% of individuals go on to develop chronic hepatitis B carriers. The most typical signs and symptoms include jaundice, nausea, liver pain, and appetite loss. A person who is infected but has no symptoms may still be contagious. Hepatitis C virus. Hepatitis C is frequently acquired by contact with unsterilized needles, which can occur during drug use, needle piercing, or tattooing. Transmission might also happen through organ and blood donations from infected donors until tougher safeguards were put in place in the early 1990s. Despite the fact that this illness usually has no symptoms, it does raise the chance of becoming cirrhosis and potentially liver cancer. Mononucleosis. Mononucleosis, which is caused by the Epstein-Barr virus (EBV), is frequently referred to as the kissing illness because to the method it is typically spread. The virus can also be contracted indirectly, for example, by coming into touch with contaminated saliva on sharing utensils or toothbrushes. One of the most prevalent herpes viruses in humans, EBV is a type of herpes virus that affects 95% of adults without any symptoms. Fortunately, mononucleosis is not usually the result. Actually, only 35 to 50% of adolescents and young adults who get it go on to get mononucleosis. The most typical symptoms include swollen lymph nodes, a scratchy throat, fever, and extreme exhaustion. Human papillomavirus (HPV). The majority of sexually active adults develop an HPV infection at some point in their lifetime. A person may contract more than one HPV type or the same HPV more than once because there are many different forms of HPV. An infection frequently shows no signs at all. In addition, while some HPV kinds disappear on their own, others raise the chance of acquiring cancer. The HPV vaccine provides effective defense against infections. Measles. Droplets from an infected person's cough or sneeze can spread the highly contagious measles virus, which is exceedingly contagious. This disease-causing virus hangs around in the air for a while, spreading the disease more widely. Despite the fact that there is an efficient and secure vaccination that may prevent it, measles remains one of the leading causes of child mortality worldwide. The term, measles, derives from a word that means, little red spots, although other symptoms can include a high temperature, a runny nose, a cough, and conjunctivitis. Cholera. Every year, between 1.3 and 4 million cases of cholera are reported worldwide. The condition can quickly result in death if untreated. The actual number of reported deaths each year ranges from 21,000 to 143,000. In many areas of the world where there are inadequate water purification facilities, cholera is particularly contagious. When food or water intended for human consumption is contaminated by an infected person's stool, transmission takes place. Most patients don't exhibit any symptoms. However, in extreme situations, diarrhea, nauseousness, and vomiting can quickly result in dehydration. Dengue fever. Tropical and subtropical areas are home to highly dangerous dengue outbreaks. The 4 serotypes, also known as serovars, of the dengue virus, DEN1, DEN2, DEN3, and DEN4, carry the infection-causing genes. The initial symptoms, which resemble those of the flu, typically start to show up 3 to 14 days later. Dengue fever affects over 50 million people annually worldwide. Mumps. Particularly in youngsters, the mumps is a highly contagious illness that frequently results in enlarged salivary glands. The major ways that this virus is spread are by saliva and airborne infectious droplets. To put it another way, kissing an infected person or contacting a contaminated surface or object can cause mumps. There were a lot of cases before a vaccine was developed. For instance, in 1967, the United States reported 186,000 instances of the mumps. Bubonic plague. 1/3 of Europe's population was wiped off by the bubonic plague during the 14th century. There are still incidences of this disease, which is fatal in 30% to 60% of cases, especially in the Democratic Republic of the Congo. Fleas that have been exposed to the Yersinia pestis bacteria, a parasite commonly found in small rodents and animals, are the primary vector for the spread of the bubonic plague. Inhaling the germs or respiratory droplets that are infected can potentially cause it. Another way to contract the illness is by direct touch with diseased human tissue. The bubo phenomenon, which causes swelling and inflammation of the lymph nodes, is one of its most recognizable signs. Pneumonic or pulmonary plague. Another plague variant, pneumonic plague, is particularly deadly and very contagious. Symptoms usually only last 2 days before someone passes away. In contrast to the bubonic plague, this variant is spread by airborne particles rather than flea bites. Patients experience a cough that finally generates a secretion that resembles raspberry syrup not long after the initial symptoms, high fever, chills, headache, chest pain, and rapid heartbeat, start to manifest. Tuberculosis. This disease is transmitted by airborne infectious droplets and is brought on by a microorganism called Mycobacterium tuberculosis. For instance, a person with tuberculosis who sneezes will release the germs into the air, which can subsequently spread to nearby people and cause infection. However, only the active type is contagious, not the latent form. The lungs are typically the first organs to be affected by tuberculosis, which results in a chronic cough, chest pain, and other symptoms. Poliomyelitis. Poliomyelitis is a highly contagious disease brought on by the polio virus. Polio is primarily spread orally through contaminated water and food in Afghanistan and Pakistan, 2 nations where the illness is still present. In the intestines, the virus then grows. Polio can, in certain cases, leave patients with permanent paralysis of the limbs, often the legs, in addition to producing fever, nausea, vomiting, and generalized malaise. Polio was eradicated in America in 1994 thanks to immunizations, but the virus has just recently vanished from Africa. Smallpox. Smallpox was one of the most contagious illnesses of the previous century but has been eradicated since 1980. The variola virus can spread to up to 10 people from one infected individual. The major ways that this contagious illness is spread are through infected materials like clothing, sheets, and blankets or by projecting contaminated droplets into the air. The main symptoms of smallpox are fever and rash, although 30% of unvaccinated patients die from it. Ebola virus. The Ebola virus does not often spread through the air, in contrast to many infectious diseases. It is necessary to come into contact with blood, saliva, or other bodily fluids from an infected person. A surface or object contaminated with the virus, such as needles, bedding, etc., might also make you ill. Ebola's initial symptoms include fever and chills, intense exhaustion, headaches, and muscle aches. A few days later, other symptoms like internal and external bleeding could emerge. Spanish flu. One of the most contagious viruses in recorded history, the Spanish flu initially surfaced in 1918. At the time, it was thought to have killed between 50 and 100 million people globally, infected 1 in 3 people, and afflicted 50% of those between the ages of 20 and 40. The immune system and lungs were the virus's main targets. The Spanish flu was transmitted through contact with infected surfaces or by airborne droplets, like other infectious diseases. Syphilis. Intimate relationships are the main method of transmission for syphilis. However, some people have caught it via using infected needles and syringes. Additionally, transmission between moms and unborn children has been seen. Patients exhibit a range of symptoms during the disease's 3 stages, as well as its latent period, including fever and genital or mouth ulcers. Syphilis can harm the heart, brain, liver, and even bones if it is not treated. Malaria. An individual typically contracts malaria after being bitten by a female mosquito carrying one of the 5 types of Plasmodium. Typically, symptoms start to show up 1 to 4 weeks later. After that, the patients experience a fever, diarrhea, headaches, sweating, chills, disorientation, and discomfort in their muscles and joints. Malaria consequences might include convulsions, coma, and in severe circumstances, death, if untreated. In Africa, deaths appear to be more common. Although a vaccination has not yet been created, there are a few preventative drugs on the market. Gastroenteritis. Since there are numerous ways that gastroenteritis can spread, it is particularly contagious. It can be acquired by consuming tainted food or drink. Another frequent method of transmission is by direct or indirect contact with infected people and places. In fact, all it takes to make you ill is touching a contaminated handle. Even though it's not a symptom, sneezing and vomiting, which is a symptom, can both spread gastroenteritis. Both release airborne infectious droplets. In actuality, the most prevalent symptoms are diarrhea and vomiting. Coronavirus infection. Coronavirus illness has swiftly expanded across all continents since it first appeared in 2019. When a person infected with the SARS-CoV-2 virus exhales droplets while talking, sneezing, or coughing, COVID-19 is spread through the air. While some people don't exhibit any symptoms, others struggle with the most typical ones including weariness, dry cough, and fever. Others may experience various coronavirus illness consequences, some of which may be fatal. Thank you for watching. Please do subscribe for more information. Please do support us.